Hunter syndrome is a rare genetic condition affecting only 1 in 162,000 live births. As it affects multiple parts of the body, the symptoms of Hunter syndrome can vary between patients and can range from hearing loss and joint stiffness to speech delay and even cognitive impairment in severe cases. Because of this variety of both physical and neurological symptoms, people with Hunter syndrome may benefit from a range of home modifications to make daily life easier and more accessible for them. In this video, we will explore some of the ways that people living with and caring for people with Hunter syndrome can adapt their home environment to suit their needs. While this will focus on modifications to make patients more comfortable and their environments as safe as possible, please also keep in mind your own needs as a caregiver. It's important to remember that looking after yourself will mean you are best equipped to also look after your loved ones. The potential modifications we will explore here are those that can be made within the home, as this is the primary space that patients and caregivers will spend most of their time. There are a range of suggestions for adaptations that can be made throughout the house, including the kitchen, bathroom, living room, and bedroom. Adaptations to your kitchen can help keep cooking and eating safe and interactive, as fine motor skills and hand movements can be affected and restricted by Hunter syndrome. Using utensils with larger grips can help encourage independence during mealtimes. Additionally, cutting up food into smaller pieces can help children with Hunter syndrome who may have difficulty swallowing due to enlarged tonsils. When deciding what meals to cook, consider possible dietary modifications that can help alleviate certain gastrointestinal symptoms. But be sure to speak to your doctor before making any dietary changes. The bathroom is one area of the house where those with Hunter syndrome may be more vulnerable to accidents, as wet surfaces can pose a risk of slips and trips. A non-slip rubber mat on the bottom of tubs and showers can help to minimize the risk. Additionally, having a sturdy stool in the bathroom can help children reach and use the sink more safely. Children love to play, and children with Hunter syndrome are no exception. Exclusively using large, soft toys with no small parts is a good idea to help keep playtime as safe as possible. Another important modification is to pad any sharp corners on furniture to limit bumps and scrapes and help keep your mind at ease as a caregiver. A lot of children with Hunter syndrome, especially on the more severe end of the spectrum, enjoy sensory stimulation. Some ideas for a more sensory-friendly living room include using a projector to display different shapes and colors, tactile panels with different textures and fabrics, and safe chew toys. Some of the physical symptoms of Hunter syndrome, such as joint stiffness and limited range of motion, can make using the stairway more difficult or even hazardous for patients. Carpeting the stairs, adding a handrail, or installing a chairlift are all possible modifications that can help to limit any falls or injuries in this area. If the layout of your home allows this, it may also be worth thinking about having the rooms you or your loved ones use the most often on the bottom floor to limit the need to use the stairs. For example, consider having your or your child's bedroom on the ground floor rather than upstairs. In the bedroom, a spare mattress or cushions on the floor can soften any falls from the bed, which can be a risk for Hunter patients that are restless sleepers. Weighted blankets may also be a good option to prevent too much tossing and turning in the night. As sleep apnea is also common in people with Hunter syndrome, they may find getting to or staying asleep difficult. Using a white noise machine or playing soothing music can help those affected to sleep more soundly. For children with more severe neurological symptoms, sensory stimuli can be helpful to keep them calm if they are prone to waking up in the night. Consider using soft lighting with movement, such as lava lamps, fiber optics, or fairy lights, as sensory tools that are still soothing enough for nighttime. If you or your child use a wheelchair, there are some general adjustments you can make to ensure your space is accessible. Wherever possible, having wider doors and hallways will make it much easier for those in wheelchairs to get around the house. The recommended width for wheelchair-accessible doors is a minimum of 32 inches, whereas hallways should be at least 36 inches wide. Using wheelchair-friendly flooring, such as hardwood or vinyl, can also make getting around easier. Additionally, reducing the amount of unnecessary furniture, such as coffee tables and extra chairs, can help to keep the home spacious enough for wheelchair users and will also help to minimize trip hazards. If you have a garden, making sure this is a safe space for your loved ones with Hunter syndrome to enjoy can be as simple as installing fences around outdoor play areas. Wherever possible, making sure outdoor spaces are also all one level, with flat, soft ground, can also help to keep children safe while playing in the garden. These are just a few of many possible adjustments that you can consider making to your home to suit the needs of you and your family while living or caring for someone with Hunter syndrome. We encourage you to explore the further resources available that are dedicated to helping patients and caregivers adapt to life with Hunter syndrome and raising awareness about living with this rare disease. Visit hunterpatients.com today to learn more. Talk to your doctor if you are concerned about symptoms or have any other questions about Hunter syndrome.